Autism parents, I'm going to give you a little bit of tough love. No more excuses. You have to choose the right nutrients for your child's health, and I'm going to tell you why. If you are feeding your child a ton of heavily processed gluten-filled products such as goldfish, Oreos, and you are definitely serving them a serving size of synthetic folic acid.
It's Patrol here, and let's critically analyze this video with regard to the relationship between celiac disease and autism. So as a pediatrician, I do see celiac disease and autism in my practice quite a lot. It's estimated that celiac disease is about 0.7% of the global population, and autism is around 0.2% of the global population. So not a lot of children that are affected. However, it can seem on social media that many children are affected. Now, there was one systematic review that tried to look at the association between celiac disease and autism and found really no relationship at all. And systematic reviews are pretty good studies because they look at a collection of studies. So what that means is that it puts children who have autism or who are neurodivergent in a bit of a pickle here. They already have sensory, taste, perception, and texture issues already and are already at risk of micro and macronutrient deficiencies at baseline. And now, if you remove gluten products from their diet, it can further worsen their signs and symptoms. And one of the most important things to remember about celiac disease is it does require blood test and biopsy testing to actually confirm if you have gluten allergy. Otherwise, by simply avoiding gluten-based products, you will not necessarily actually have celiac disease, and you may not necessarily notice any significant benefits of avoiding gluten. I think sometimes we associate things like diarrhea, cramping, eczema, bloating, weight loss with celiac disease. However, if you truly don't actually have biopsy-proven celiac disease, you're avoiding nutrients that are actually really good for you because a lot of gluten-based products are found in things like rice, grains, and breads, which have amazing vitamin Bs, fiber, as well as other really good nutrients as well. So if you do have a child who is neurodivergent or on the spectrum and you are worried about nutrient deficiencies because they do have sensory issues, you should talk to your family doctor or your pediatrician or your dietitian to figure out whether or not there is concerns for true celiac disease. If that is the case, rather than avoiding gluten-based products, seek medical attention. And if your child does need blood work or biopsy testing to prove that's the case, then appropriate measures can be made in terms of making sure that your child has adequate nutrition and a gluten-free diet.